Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Antibiotic Awareness. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is depression and long-term care. And if you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guest today, Emilee Melchior. Emilee is a healthcare-associated infections antimicrobial resistance epidemiologist for the West Virginia Bureau for Public Health's Office of Epidemiology and Prevention Services. With a background in public health and 9 years of experience, she has worked in various settings, including environmental health and epidemiology. Emilee lives in Huntington, West Virginia with her husband and son and is a proud graduate of Marshall University. Emilee, thank you for joining us today.
Hi, good afternoon. Thank you guys for having me. I'm here this afternoon to discuss the upcoming Antibiotic Awareness Week, and we will go ahead and get started. Here are the objectives today. We will do an overview of Antibiotic Awareness Week and explain how healthcare facilities can get involved. So before we get started with Antibiotic Awareness Week, I wanted to give some background on antibiotics, and here in a moment we'll get into some specific West Virginia rates. But is antibiotic resistance really a problem? The answer is yes. Penicillin is the first commercialized antibiotic, and it was discovered in 1928 by Alexander Fleming. And germs are always looking for ways to survive and resist new drugs. More and more germs are sharing their resistance, making it harder for us to keep up. Today, antibiotic resistance has become a worldwide concern and is considered to be one of the most pressing public health concerns. The World Health Organization classifies antimicrobial resistance as one of the top 5 health threats. Antibiotics are among the most frequently prescribed medications in nursing homes, with up to 70% of residents in nursing homes receiving 1 or more courses of antibiotics when followed over a year. Studies have shown that 40 to 75% of antibiotics prescribed in nursing homes may be unnecessary or inappropriate. An inappropriate antibiotic may include the wrong antibiotic, the wrong dose, route, or duration. The CDC reports that more than 2 million illnesses and 23,000 deaths are related to antibiotic resistance. And to give an idea of where West Virginia ranks in terms of outpatient prescribing, the national average is 709 per 1,000 population. In comparison, West Virginia has a rate of 1,184 per 1,000 population, identifying West Virginia as having the highest outpatient antibiotic prescribing rate in the nation. Again, this is outpatient, but it still gives a telling picture of antibiotic use in West Virginia. Antibiotics can save lives when used appropriately and are a much needed drug. However, it is important to be cautious, and here are a few reasons why. Antibiotics increase the risk of getting an antibiotic-resistant infection. They kill the healthy bacteria in the gut and allow for more harmful bacteria to grow, such as C. diff. Are the most frequent cause of adverse drug events leading to emergency department visits in children. Adverse reactions to antibiotics cause 1 out of 5 emergency department visits. And antibiotics diminish the function of the microbiome, creating long-term effects. And a lot of conferences and webinars that I've sat in on lately have, discussed the microbiome and how important it is to your overall health. And it's also to remember that antibiotics are given for bacterial infections and will not cure viral infections such as the colds or flu. with that all being said, and taking into consideration that we are #1 in outpatient prescribing with antibiotics, our department really wanted to highlight the U.S. Antibiotic Awareness Week this year. So the Department of Health invites healthcare facilities across West Virginia to participate during U.S. Antibiotic Awareness Week to raise awareness of the importance of preventing infections, improving antibiotic use, and combating antimicrobial resistance. Antibiotic Awareness Week is November 18th through the 24th, and that's every year. And this year, CDC is focusing on how fighting antimicrobial resistance takes all of us. No single group can effectively combat antimicrobial resistance alone. Doing so requires collaboration across multiple sectors, including human, animal, and environmental. We would like to use this observance as an opportunity to work collaboratively in our efforts to highlight the critical need for appropriate antibiotic use and infection prevention measures to combat antimicrobial resistance. So the CDC has developed a digital toolkit to provide anyone who's interested in participating in Antibiotic Awareness Week. This is an overview of why it's important to observe Antibiotic Awareness Week and how to participate in the week. And this includes key messages, sample social media messages, graphics, stickers for your social media profile pictures, and a virtual meeting background. And I do want to note that this toolkit is different from the B Antibiotics Aware toolkit, and I'll talk about that next. But first, let's take a look at the U.S. Antibiotic Awareness Week toolkit. Kathy, if you want to drop that link in the chat, I'm going to pull the web page up here.
All right. Here's the link, and we can see the webpage on your screen now.
Great. So this is the U.S. Antibiotic Awareness Week toolkit. And it is very user-friendly. It is on one web page, but all of these links will take you directly on the page what you're looking for. So as you can see, there's a how to use the USAAW toolkit, the daily themes and key messages, sample social media messages and graphics, Go Purple for USAAW and how you can participate, the hashtag USAAW24. And here we're going to get into the daily themes and key messages. So every day they've broken it down, starting on November 18th, fighting antimicrobial resistance takes us all. And it has a key message here. Every day is broken down. November 19th, the global threat of antimicrobial resistance. November 20th, human health and antimicrobial resistance. 21st, animal health and antimicrobial resistance. They get into some antimicrobial resistance in agriculture and the environment. One health approach to antimicrobial resistance. And then they finish it up on November 24th with continuing the fight against antimicrobial resistance. So a really great resource here is they have these pre-populated social media messages, make it super simple for you just to copy and paste it onto your own social media, Facebook, Twitter, LinkedIn, anything that your facility uses, that these messages can be shared on. So this is just kind of an overview of the toolkit. Like I said, it's super user-friendly. Here are some of the graphics, social media stickers, and some more additional resources to use during the week. So Kathy did put this in the chat, so feel free to go and visit this on your own time and give a little bit of a deeper dive into that. Okay, I'm going to go back to the PowerPoint. Are you guys able to see this?
Yes, we can.
Okay. So in addition to the U.S. Antibiotic Awareness Toolkit, another resource is the Be Antibiotics Aware Toolkit, and this complements the USAAW toolkit by providing additional key messages, sample social media posts, graphics, and videos that you can use. So we'll take a look at that. So this campaign was started several years ago. They continue to update the different resources on the page. But this is where you will find a lot more healthcare specific resources for antibiotic awareness. Let's see here, what do we have? So the toolkit, again, we have social media messaging, downloadable graphics that can be shared on social media. A lot of great resources that can be shared with families, residents, healthcare personnel, providers. So that is an additional resource, the Be Antibiotics Aware Partner Toolkit. Okay, going back to the PowerPoint. Now let's talk about another way to get involved, and this is a new exciting program that aims to promote antibiotic stewardship core elements for nursing homes, and this is the Maximizing Efforts Dedicated to Antimicrobial Leadership and Stewardship program, which we will refer to as MEDALS. The purpose of the medals is to recognize facilities that have elements in place to support an antimicrobial stewardship program and are working to improve antibiotic use and infection prevention practices. Antimicrobial stewardship program plays an important role in healthcare, including reducing the development of multi-drug resistant organisms. So why participate in the medals program? Facilities will receive recognition for commitment to antibiotic stewardship and infection prevention and control by receiving a certificate of achievement. We will provide resource manuals that include audit tools, practice guidelines, patient education, and educational curriculums, one-on-one consultation to provide technical assistance, access to stewardship expertise, and we will post the facility name on our medals webpage, indicating the facility's collaboration and achievement level. So the medals program has 4 levels that you can apply for. We have bronze, silver, gold, and platinum. The bronze level here, we have the criteria, and this includes a commitment letter from leadership, an antibiotic stewardship committee in place that includes executive level, pharmacy director, and a physician champion, participation in a preventative infection control assessment, conduct one facility-wide Project Firstline training, and conduct one facility-wide antibiotic stewardship or antimicrobial resistance training, including healthcare personnel, residents, and family. So that's the criteria for the bronze level. Silver level activities include all of the bronze level activities just mentioned. And then in addition, monthly training relative to antimicrobial resistance or infection prevention, implementation of a hand hygiene program with competency, validation, audit, and feedback, implement monitoring and tracking of antibiotic use, and quarterly Project Firstline training using Project Firstline curriculum. And I want to mention, this may have been mentioned on previous webinars, but our office does have a dedicated Project Firstline coordinator now. So we do have someone in our office that can help you sort through all the Project Firstline training curriculum and, decide what is a best fit for your program. Third level is gold, and this includes all bronze and silver activities. In addition, monitor and provide feedback of antibiotic use, including rates of new antibiotic starts and antibiotic days of therapy. Monitor facility-specific outcomes and provide feedback, including C. diff rates and targeted MDROs. one person from facility to complete the CDC antibiotic training course, and one person to complete the CDC infection prevention training, and conduct quarterly infection prevention training specific to environmental service staff or housekeeping. And top tier level is platinum, and this includes all bronze, silver, and gold activities. In addition, we would like to see the facility reviewing the antibiotic susceptibility patterns, and this can be provided by your lab. It's referred to as an antibiogram. Distribute quarterly provider feedback for antibiotic use, and participation in one infection prevention or antibiotic collaborative. So verification of activities. A schedule will be coordinated with the ICAR team, the metals project coordinator, and the facility to make an on-site visit to determine if the facility meets the criteria. So during that time, we will review supporting documentation. Some of the things we're looking for are sign-in sheets for your training, which Project Firstline curriculum did you use, meeting minutes from your antibiotic stewardship committee, documentation like that. So facilities are able to register now. We're in the process. We've got about 10 facilities so far that we have evaluated, but the form for application is available on the OEPS Metals webpage. And I want to give a shout out to Sundale and Morgantown. They have achieved the platinum level. Nella's of Autumn Lake and Autumn Lake of Crystal Springs has achieved gold. And Complete Care at Dawnview has achieved bronze. So congratulations, and we hope to see the list grow. So we've discussed a ton of great resources for Antibiotic Awareness Week, and I wanted to recap some ways that your facility can get involved. So first, visit the USAAW webpage to use the resources that are in the toolkit, and that means the broader Antibiotic Awareness Toolkit and the Be Antibiotics Aware campaign toolkit. Second, we want you to go purple for USAAW, wear purple, work with your facility to light up the building purple, bring purple to your social media by sharing your purple pictures and using the hashtag antimicrobial resistance or USAAW24. Share and distribute Be Antibiotic Awareness educational material for patients and families and healthcare professionals. And for long-term care facilities, we encourage you to apply for the Metals program. And here is my contact information. If anyone has any questions about Project Firstline, how to get involved with antibiotic awareness or the Metals program, please reach out.
All right, thank you, Emilee. And I put the information for the Metals program in the chat. That program is only for West Virginia facilities. There's also a similar program in Pennsylvania. Let's see, and I will also share the information for that in the chat, since we have some Pennsylvania facilities here today too. Okay. All right, thank you, Emilee. And I believe we can get started on the Q&A. If anyone has a question or comment, please submit it using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand if you'd like to ask your question out loud. And while we're waiting, I'd again like to invite everyone to next week's webinar, which is on depression in long-term care. That will be the same time and place next Wednesday at 2 p.m. We also invite you to bring your questions to our virtual live chats, which are every Tuesday and Thursday at noon. One of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to the live chats and our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list yet, you can email me at ccaudill@qualityinsights.org and I will get you on that list. And now I will put my information in the chat along with the contact that Emilee just had up on her screen. And let's see if we have any questions. Oh, we don't have any questions so far. So I believe we can get ready to wrap up. Emilee, do you have anything you'd like to add before we close out today?
I just wanted to thank the ICAR team. I know there's a couple members on here for their collaboration. They've been going out with me on these medals visits. So thank you guys for spreading the words in nursing homes in West Virginia. Thank you.
All right, thank you, Emilee. And I think we can go ahead and wrap up for today.
Kathy,
Yes.
this is Penny. I just wanted to share for the Pennsylvania nursing homes, the website that Kathy put in there. It will connect you to the Pennsylvania Department of Health. There are a lot of resources for antimicrobial stewardship. There's a newsletter called The Steward that goes out from there. So if you want addition, and it connects you to the Pennsylvania Project Firstline. So that is a little bit more specific to Pennsylvania nursing homes. And I'd just like to say that I love the medals program, and maybe that's something that we can encourage PA Department of Health to do for us sometime, because it sounds like a great program. And thank you, Emilee.
Thank you so much, Penny. And thanks for adding that. And I've got, as you mentioned, I put in the chat the link to that Pennsylvania program, along with the link to the medals program. So I think we are good to wrap up. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Emilee, I'd like to thank you for joining us today and for this great presentation. And I'd like to thank everybody here for joining us here today, and we hope to see you again soon.